everybody, welcome back to another episode of Physio Show. Today is all about lateral epicondylalgia, that pain on the outside part of the elbow, also known as tennis elbow. Can be quite uncomfortable, maybe even keeping you up at night with that throbbing pain on the outside part of the elbow there. This is a common condition that is not only experienced with just playing tennis. This is a tendinous pathology, meaning that the tendon right along there on the outside part of the elbow where it inserts into the humerus bone is inflamed or just overused. Sometimes you'll have an inflammation, which is called a tendinitis, or even a chronic issue, which is more of a tendinosis, which is actually the degeneration of the tendon itself. With this condition, we want to get this tendon back to being full strength because this takes a lot of force throughout the day with a lot of our activities like gripping and lifting and carrying. So this tendon needs to be at full strength to function at a high level. And this is where many of the people have issues, is that this tendon becomes weak over time and it just kind of snowballs and worsens the issue. Pain starts to get worse, the function of the hand gets worse. So in today's episode, we are going to focus on quick and easy assessments, but also treatments for tennis elbow. I'm going to show you multiple ways to improve mobility and improve strength of that tendon. So let's get to it. So how do you know you have tennis elbow without actually getting examined by a professional? Well, there's 3 tests that we do in clinical practice to identify those with tennis elbow. So the first test is you're going to take your hand, you're going to straighten your elbow, keep your wrist in neutral here, nice and aligned with your forearm. What you're gonna do is you're gonna take your other hand and you're gonna apply pressure here and you're gonna resist. So you're gonna push up with the bottom hand, push down with the top hand, and if that recreates any pain along this side of the elbow, that's a positive test. The next test is straightening your fingers. You're gonna take the other hand and you're gonna resist this middle finger here. So I'm gonna push up with my middle finger, I'm gonna resist with my other fingers here, and I'm pushing up, and if that recreates pain as well, that's a positive test. For the third test, you're gonna take your hand, you're gonna bend it. You're gonna flex your wrist. I'm gonna take my other hand, you're gonna put a little pressure down, and then what we're gonna do is you're gonna straighten your wrist here. And if this recreates your pain on the outside part of the elbow, that's a positive test. So if all 3 of those tests are positive, you can be pretty sure that it's tennis elbow. Another assessment too is just simply touching the side of the elbow here. This is where the tendon lives. You're gonna find this bone. This is called your lateral epicondyle. You're gonna drop down just a little bit, about like a 1/2 inch to an inch, and you're just gonna poke around here. And usually people with tennis elbow will have quite tender tendons here, and that's another consideration for tennis elbow. So those 3 positive tests, along with tenderness along the outside part of the elbow where the tendon is, you can be pretty sure it's tennis elbow. So as mentioned, I'm not going to be stretching this tendon very much. I just tend to find that it inflames people. A lot of common tendinopathies, stretching is really not the go-to because the issue is not mobility of the muscle and tendon, it's mostly a strength deficit. So you're not going to stretch your way out of this. We need to restore the strength, but mobility is key. And what you find with lateral epicondylalgia or tennis elbow is people have limitations in their ability to extend their wrist. They just have stiffness either in the wrist here or the forearm flexor muscles here, and they also have trouble extending their elbow. It might be due to biceps tightness or even stiffness in some of these joints here in the elbow. So to help with those mobility limitations, I'm going to show you 2 quick and easy self-mobilizations to enhance both wrist extension and your elbow's ability to extend. All right, to help your wrist extend, all you need is a table that's roughly waist height. So you're going to take your palm of your hand, you're going to put it flat. You're going to take the other hand, the web space, so the thumb and the index finger, this space right here, you're going to position that right at the crease of the wrist. Once in position, this hand is going to be stabilizing that wrist, and now keeping your hand flat, you're going to just gently shift your weight by keeping your palm flat over your hand, get a good stretch, and then come back up. So you're going to hold that for about 5 seconds. We're going to repeat for 10 to 20 reps. And then come back out. So you're going for like a mild stretch, hold that for 5 seconds, and then come out of that stretch. All right, now that we've improved the flexibility of our wrist, it's now time to improve the flexibility of our elbow. Again, to straighten the elbow out, to restore the length-tension relationship of these muscles that are affecting the tendon. So all you'll need is something to help stretch, and I'm gonna be using a PVC pipe. You could use anything. It could be a broom handle, Swiffer handle, could be a golf club, lacrosse stick, whatever you have at home. What you're gonna do with this, you're gonna put it right above your elbow, okay? Right where that bone is, right above on your tricep. You're gonna take your hand, you're gonna put it flat on the table. The hand should be kind of pointed back at you, okay? So flat on the table, the stick is right above that elbow there. You're gonna use your other hand in your body and you're gonna just slowly rotate away, okay? Maintaining force right at the elbow, and you notice my elbow is gonna be straightening out. 5-second hold, and then relax. And just gently rotate away. Allow this stick to push your elbow into extension. Get like a mild stretch, 5-second hold, and then come out of it. And we're gonna repeat 10 to 20 reps, or as tolerated. Mild stretch will do, and then come out. So as we discussed, the key to this rehab is getting strength back in the tendon and muscles. But you can't do good strength training if you have too much pain. So I'm gonna show you 2 strategies to manage your pain. One's a lateral elbow mobilization with movement, and the other is some soft tissue mobilization techniques or massage techniques that you can do prior to exercise to get the pain down and to get more benefit out of the strength training. Now, I like to teach the elbow mobilization with movement a little differently than anybody else because I find the way that it's usually taught to be a little bit cumbersome and hard for people to relax. So I prefer to do this actually laying down on my side because I tend to find it helps relax some of the musculature surrounding the joint. You don't want these muscles kicking on when you're trying to get the joint to move. You do need something to stabilize your arm though. You can use a book, you can use a yoga block. I'm gonna use this oval foam pad. So to get into position, you're gonna lay on your side, the same side as the affected arm. So you're gonna position whatever you're gonna use to stabilize your arm right above these 2 bones. You're gonna take your towel, put it in your hand. This is what you're gonna grip. You're gonna take your other hand, your web space, find the crease of the elbow, and you're gonna apply a gliding motion or a pressure in the direction of the floor. Now notice my elbow is up in the line of force, and I'm gonna apply a sustained pressure, and then I'm gonna squeeze, hold for 10 seconds. Now again, I'm looking for a reduction in pain. So if this feels good, I'm gonna stay here. If it doesn't, I'm gonna change my angle of my force or even modify the pressure. Try again. If that doesn't make a substantial improvement, I'm gonna maybe change the forearm position in terms of where my arm's going up or down, reassess, and see if that made any notable improvement. And you're looking for a notable improvement in pain symptoms. Ultimately, pain-free is what we're looking for. And we're going 10 seconds, holding for 10 repetitions. And again, this is a great technique to do prior to your exercise to reduce your pain so that you can do more effective strength training as it's not limited due to discomfort. You're gonna take the ball, you're gonna apply it right on the forearm where the muscle is, specifically the extensor carpi radialis longus and extensor carpi radialis brevis. These are the muscles that are typically implicated with tennis elbow. So we want to get the tone of these muscles down, and you can do that by a little self-massage. So you're gonna modify the amount of pressure. This is a pain versus harm situation. So despite the pain that you may have with this, you're not causing any damage, it's just uncomfortable. But modify it based on tolerance. You don't wanna be bruising yourself either. So I go for just gentle pressure, a little bit of discomfort. I have a nice trigger point right there. And what you can do is massage it, or you can even just hold the pressure there. We call this a ischemic trigger point release. So we're just gonna hold it on that point. I'm gonna count about 30 seconds to a minute. You may notice that your pain might increase a bit when you start to apply force, and then it will slowly subside as that trigger point gets desensitized and starts to relax. So this ischemic release technique is a good one, especially if you can't tolerate too much movement. So I like to start with the ischemic release, and then as that trigger point starts to dissipate, which right now it starts to go away a bit, it's less intense, I'm gonna wait for it to kind of subside, and then you can do a little bit more of a dynamic massage, which may be a little bit too uncomfortable to start with. So start with that ischemic release, that static pressure first, 30 seconds to a minute, and then once that starts to get more comfortable and the pain starts to subside a bit, then you can add a little bit of more of a dynamic massage, and you're going all directions, up and down. You can go left and right, little circles. You do want to attack the tissue in different angles. after that, because that was primarily muscle-directed massage, we would now want to direct some attention to the tendon itself. So how do you find the tendon? Well, you're gonna hold your arm like this, and you're gonna find these two bones here on the elbow. They're on both sides. This is the medial epicondyle, this is the lateral epicondyle. So once you find the lateral epicondyle, it's gonna be that bony prominence right on the outside part of your elbow. You're gonna drop down slightly, down towards your hand, just very slightly. I would say maybe an inch or two. And then what you're going to do there is you're gonna strum side to side. So this is called cross friction massage, and you should feel like a cord-like tendon underneath your fingers. And this is the common extensor tendon. This is where the tendinopathies live. And what we're doing here is helping desensitize this tissue and actually help promote changes in the collagen or the fibers that make up the tissue. You're trying to help kind of stimulate remodeling here. So this is a bit of an aggressive massage. So you are applying a little bit of force here, again to tolerance, but pain versus harm. This is something that we want to tolerate but not avoid. So I'm going to be cross-frictioning this tendon here, usually for 30 seconds to a minute or so. Moderate pressure here to tolerance. And this is a good one to do daily along with the lacrosse ball or whatever ball you're using to keep the muscles relaxed, and then also continue to stimulate remodeling of this tendon, and actually helps to do a little bit of a desensitizing maneuver too. Just helps calm down the tendon and not get it as sensitive to movement. Loosen up a little bit and promote a little bit more blood flow to the area. So as we mentioned, the long-term gains is going to be coming from strengthening these muscles here. These muscles need to be able to function at a high level and tolerate increased forces throughout the day. It doesn't really matter how flexible they are if they don't have the strength to control that flexibility now. So now we're going to be focused on enhancing the muscle's performance in that new available range of motion that we just achieved with our mobility exercises. And this is what's going to translate to those long-term outcomes. So the name of the game is heavy, slow resistance training. And I'm not as concerned about what type of weights or bands you use, as long as it's adequate resistance. So we're looking for a moderate fatigue, usually around the 5-6 range to start, and then even going up to that 7, 8, 9 out of 10 fatigue range as your symptoms tolerate. But for right now, we're assuming that your symptoms are low irritability, meaning that they can actually tolerate a little bit of resistance without excessive flare-ups. So there's a concept called time under tension, which it means the amount of time that your muscles and tendons are under tension. So I like a 3-second count. 3 seconds up, a little pause, 3 seconds down. And you want to stick with that amount of time to ensure that your muscles are being loaded sufficiently enough where you're going to reap the benefits of the strength exercises. So to start, I would perform these exercises with your elbow slightly bent. Doing the exercise with the arm fully extended is a little bit of a progression, and you have to kind of work your way up there. So let's start with the elbow bent first. I would start off with the lightest of tension or lightest of weights just to see how your body responds, and then progressively build up. So to start, we want to get a towel roll or just something to support our forearm while our wrist moves. We don't want any of our arm to move while the wrist is activated. We want to try to isolate all of this exercise right to this common extensor muscle to get the most benefits for the tendon. Again, the resistance band or weight is something that's of moderate resistance to start. Isn't too much weight where I can't go through the full range of motion, because you want to prioritize that. Make sure it's not too heavy where you're coming up short. You want to be able to go through that full range of motion with good control and fatigue and keeping our symptoms in check. So to set up, the towel roll is going to be right at the bottom of our forearm here. I'm using a resistance band. We're going to go up for 3. 1, 2, 3 seconds, little pause, down for 3. 1, 2, 3 seconds. So this is the time under tension. 1, 2, 3. I'm ensuring maximal resistance at this muscle here, maximal load exposure. 2, 3. Because this is what tendons respond to. They respond to this load that I'm exposing it to. This is how you're going to get the benefit and get them to remodel and get stronger. If it's too quick, the time under tension is low, they're not going to be able to get as much exposure to the force, and they're not going to change as much. So 3 seconds up, 3 seconds down. Nice controlled movements. I'm gonna shoot for high reps to start, usually 4 sets of 10 to 12 with a moderate resistance, not too much symptoms. As I get better at this and as my symptoms allow me to, I'm gonna get heavier with the band, and then I'm gonna drop those reps down probably to 4 sets of 8 or so. And by that 4th set, I should be pretty tired. I should know exactly where this muscle lives. So just to recap, when it comes to resistance training, we're not afraid of pain or soreness, but we definitely wanna keep it in check. And the symptoms should subside within 24 hours. If they're lingering more than that, it's probably too much weight, and we just need to drop it down a little bit. The name of the game with any tendinopathies is strengthening the tendon to get it more resilient and tolerating more forces throughout the day without overly exerting it. So just as important as it's to strength train the tendon, it's also important to give it plenty of rest. So usually I won't do more than 3 times a week for heavy, slow resistance training. And then in the off days, just focusing on just keeping the tone of the muscles down with some of the massage techniques and maybe a little bit of cross friction and some isometrics during those off days. And then the on days are more of that heavy, slow resistance training. So whether or not throughout the day you're just flaring this thing up because you're just overly exerting it, so you might have to tone down how much you're lifting or how often you're lifting. Another smart thing you can do throughout the day if you do have to use your hands a lot is to take pressure off this outside part of your elbow is a wrist brace, because if you stabilize the wrist, you're not utilizing this muscle as much, or you're just taking the load off of it. So that's gonna help calm down the tendon as well. Another option is a tennis elbow brace, which goes right below the elbow, and it just kind of changes the force distribution of the tendon and unloads that tendon a little bit more. So if you can just get away with a tennis elbow brace, that would be the best bet. But if you really need to be conservative and remind yourself not to flare it up, a wrist brace might be the best way to go. I linked some examples of the tennis elbow brace and wrist brace that you could utilize for tennis elbow in the description. Well, I hope you enjoyed this episode of Physio Show. Please like and subscribe to the channel to continue to help us grow so we can continue to provide you quality physical therapy related content. Physio Show.